Good morning, friends. Today we will be discussing about another important topic, that is Marfan syndrome. Usually one question regarding Marfan syndrome can be asked. So what is Marfan syndrome? What are the components of Marfan syndrome? How is it inherited? First of all, it is autosomal dominant inheritance. Mutation is in fibrillin 1, also written as FBN1 of 15 chromosome. It is characterized by features of skeletal system, CVS and ocular. What are the skeletal features? First of all, patient will be tall with long limbs, and the ratio of upper segment to lower segment will be below 2 standard deviations, and there can be arachnodactyly, chest deformities like pectus carinatum and pectus excavatum, and spine deformities like scoliosis and kyphosis can be seen. And very important thing, CT MRI of lumbosacral region. It shows enlarged neural canal, widening of foramina, and very important thing is dural ectasia. Along with this, there can be high arched palate with high pedal arches, pes planus. Now let us see what are the ocular features. There is usually dislocation of lens, it is upward, and patient will be myopic. Next, coming to the cardiovascular features. This is very important, cardiovascular features of Marfan syndrome. First thing is mitral valve prolapse, usually occurring early in life. It can progress to mitral regurgitation, and dilatation of root of aorta and sinuses of Valsalva. There will be formation of aortic aneurysms. The pathology involved here is called as cystic medial necrosis. It is also called cystic medial necrosis. It is nothing but a degeneration of collagen and elastin fibers in tunica media. The cystic medial necrosis is also seen in other syndromes like Ehlers-Danlos syndrome and something similar to Marfan's Loeys-Dietz syndrome. If at all a patient has already familial aortic aneurysm, then they develop at base of abdominal aorta. Next, how do you diagnose it? The first thing is mutations in fibrillin 1 gene, but all cases does not have the mutation. Some can have mutations in transforming growth factor beta receptor 2. Also remember, in some mutations in transforming growth factor beta receptor and 1 and receptor 2, they can also cause another entity called Loeys-Dietz syndrome. It is characterized by aneurysms. We have discussed the cause is cystic medial necrosis, and there can also be cleft palate and hypertelorism. Very important thing for Marfan syndrome is for diagnosis. The criteria is called Gent Criteria. it consists of both the major criteria and minor criteria, compromising the skeletal, CVS, and dural ectasia. These are all the components. So this is the way we diagnose Morphon syndrome. Thank you.